Hi, my name is Marissa, and the topic I chose is Polycystic Ovary Syndrome. So, what is PCOS? Well, before we get into the technical definition, let's take a look at the words themselves. When we look at the words Polycystic Ovary Syndrome, a few things should jump off the page. First, the prefix poly, meaning multi or many. Then we see the combining form cyst, literally meaning bladder, cyst, or sac. And lastly, the suffix ic, meaning pertaining to. The next word is ovary, which we should all easily recognize as an organ in the female reproductive system. And lastly, we have syndrome, which we know is simply a group of symptoms that are connected to one another, typically by a disease or disorder. So, just by looking at polycystic ovary syndrome, we've defined it. We know it's a set of symptoms pertaining to many ovarian cysts. PCOS is a hormonal imbalance found in women of a reproductive age that is characterized by the overproduction of the male hormone androgen. So far, only about 10 to 20% of females are affected, although in recent years there has been a significant increase. Despite years of research, what causes PCOS is still unknown. Studies have shown a prevalence among family members, which suggests individuals may be genetically predisposed to having PCOS. And while there currently is no cure for PCOS, there are a multitude of treatments readily available. This is a drawing that shows the physical effect of PCOS on the body. The left ovary is what a normal, healthy ovary should look like. However, the right ovary has become enlarged and contains multiple small follicles or cysts, hence polycystic ovary syndrome. Also, the right fallopian tube is significantly shorter, which affects fertility. In fact, about 5 to 10% of women who have PCOS are unable to conceive on their own. PCOS has quite a few distinct signs and symptoms, from abnormal menstruation or even no monthly period, obesity, acne, and even acanthosis. Most women diagnosed with PCOS suffer from depression and infertility. A more striking symptom of PCOS is hirsutism, which is a condition of male pattern hair growth. Pictured on the left is an example of female baldness brought on by PCOS. To the right is a picture of hirsutism, the condition of male patterned hair growth. Keep in mind, it isn't just on the face, but also the chest and back. Acanthosis, pictured below, is a dark thickening of the skin which affects the hands, armpits, groin, and neck. Now, there are three main factors physicians look for when diagnosing PCOS. First, the overproduction of androgen. Second, other disorders involving ovulation. And third, cysts within the ovary or ovaries. There are also two main methods to diagnose PCOS, one being by measuring and monitoring the ovaries via ultrasound, and the other is by blood tests. While there is no definitive cure, there are several ways to alleviate the symptoms of PCOS. The biggest treatment, one could say, is making the decision to eat healthy, exercise regularly, and finding positive coping strategies. This, along with hormone therapies and medications, allow women with PCOS to maintain quality of life. PCOS presents unique issues that many find difficult to cope with. Women with PCOS tend to struggle with feeling abnormal, unfeminine, and embarrassed due to the increase in unwanted body hair, aka hirsutism. The typical feelings of depression and disappointment that follow infertility are also prevalent. Because of this, PCOS doesn't just affect the body, but also a woman's mental health. It's extremely important to help foster a positive body image for any woman, but especially those dealing with PCOS, which is the case of Leah Jorgensen. At the age of 14, she was diagnosed with PCOS. For years, she struggled with hirsutism, going as far as only wearing long sleeves, shaving, waxing, and ultimately hiding parts of her body. After a car wreck changed her perspective, Jorgensen took the stand and now shares her story with other women who suffer from PCOS. She says, "I hope that sharing my story will give others courage, and to the women who have hirsutism, you're not alone." It's the stories like this that allows those struggling with PCOS to begin their journey to a positive body image. I hope this presentation has not only opened your eyes to the clinical side of PCOS, what it means physically and anatomically, both the signs and symptoms, but also the emotional toll it takes on an individual. Thank you.